as we know, Tenecteplase, with its ease of administration, with all the supply chain issues owing to the pandemic, there was a change in practice ahead of change in guidelines in many jurisdictions, not in Canada, but especially in the US. Centers in Australia shifted to Tenecteplase even before the guidelines have changed, just owing to practical issues and logistic reasons. Having said that, this is the first large phase 3 trial which has actually proven Tenecteplase to be non-inferior to Alteplase. So we definitely think that it's going to be a reasonable alternative. And we are aware that we're working with many other guideline committees to make that change happen.